Facing another weekend of potential emergency room closures, 3 healthcare unions are urging the Ford government to implement a 5-point plan they say will address critical staffing shortages at hospitals across the province.
What we have today in Ontario is a failing healthcare system.
It is a dire warning that more hospitals could be forced to close ICUs and emergency departments in the coming days.
I call it the silent closures, because our communities have no idea what is really happening within those walls.
At least 25 hospitals in Ontario were forced to scale back operations and close units last weekend due to staffing shortages. According to the unions, there are 20,000 unfilled hospital positions in Ontario, a situation that will only worsen if concrete steps aren't taken.
We have a workforce that is exhausted, demoralized, and looking at the door.
The unions are proposing a 5-step plan to address the staffing crisis. Step 1, support the existing workforce by reducing workloads and offering full-time employment. 2, increase wages to attract and retain staff. 3, put in place financial incentives to discourage retirements and enhance hiring. 4, recruit with incentives for the thousands of nurses and other healthcare workers who are licensed and not working. 5, expand post-secondary spaces for health disciplines and offer financial incentives to study and practice in Ontario.
I say this sincerely. If Premier Ford doesn't like our plan, then what's his? The real-life consequences of Premier Ford's reluctance to invest in the people on the front line of care is continued hospital closures.
A spokesperson for Health Minister Sylvia Jones tells us in a statement they've launched the largest healthcare recruitment campaign in the province's history, already adding 10,500 healthcare workers to the system. They say they've also directed the College of Nurses and College of Physicians and Surgeons to report back in 2 weeks on a plan to register new healthcare staff.
The government still has no real comprehensive plan to staff up our hospitals, and this is completely unacceptable.
The government maintains this isn't an Ontario-specific problem, but rather hospitals across the country are facing the same pressures, but healthcare unions say Ontario continues to be the poorest performing province when it comes to healthcare. For City News, I'm Yazdani.